Let's dive into the discussions shaping the nation.
Taoiseach, I want to read you a letter. It's from Nikita Clark. She's from Dublin. I met her recently and she suffers from suspected endometriosis. Thank you for taking time out of your day to read this letter. Please listen carefully. This isn't easy to talk or write about. I'm 18 years old, and instead of getting my driver's licence, picking out a Deb's dress, studying for my leaving cert, going out with friends or getting a job, I spend my days sitting in bed in horrific amounts of pain. My days just roll in all together. I barely get any sleep because of pain. Everything I do isn't without a high level of pain. Walking hurts. I have to use a walker and a wheelchair to get around. I need help getting dressed, having a shower, doing my hair, going to the toilet. It's humiliating. Being a young woman once full of hope and dreams, now completely numb. I don't allow myself to feel, because if I do, I won't be able to stop. I've to watch my friends move on with life, going to parties, graduating, getting their licenses, and so much more, while I hate weekends, because it means a doctor won't call to set up my surgery. How sad, an 18-year-old who hates weekends. I need the surgery to see if I have endometriosis. It's been 3.5 years. I've been patient. I've done everything the doctor told me to do. I'm fully dependent on my mum. I get headaches that blur my vision. I have pain peeing, stomach pain. I've bleeding constantly with breaks only of a few days. How am I meant to stay happy and hopeful when no one's listening to me or helping? I once dreamt of being a lawyer, a doctor, a nurse, of having a family of my own. Now I'm a young woman alive, but not living. Please help me to live again. Endometriosis is a crisis in women's health, Taoiseach. Endometriosis is a chronic inflammatory whole-body disease. It affects the pelvic region, the uterus, fallopian tubes and the cervix. It affects 1 in 10 women in Ireland, and yet it takes 9 years for a woman to get a diagnosis here. Often by the time an endometriosis diagnosis is received, the disease has spread beyond the reproductive system. It can travel to the bladder, bowels, diaphragm, and even the lungs. Instead of receiving excision surgery here in Ireland, many women and girls are forced to travel abroad to have the specialised surgery and receive an official diagnosis. And the lack of understanding and awareness often sees the suffering of women and girls dismissed, their pain often put down to bad periods. So instead of getting proper care, they receive outdated treatment that prolong pain and trauma. Tá géir céim in bheadh tróise I gcóram sláinte na man in Éireann. Cuirtar íceal bhná diagnós agus córam a lorg thar lár. Bíonn a lán fullingt go ciúin. So caithí an rialtas gníomhú chun deireadh a chur leis an gráchraí seo. This scandal, Taoiseach, has impacted on thousands of women, with very few families left unaffected, and it's gone on for far too long. So Taoiseach, will you commit to delivering a long overdue specialised centre for the treatment of endometriosis? And will you ensure that the provision of excision surgery in Ireland is available so that women aren't forced to seek care abroad?
Taoiseach.
First of all, I want to thank you for raising the issue and also for reading out Nikita's letter to you, which clearly illustrates the very, very debilitating impact that endometriosis can have on women. It is extremely debilitating, painful, and the span of impacts are very, very wide. And in terms of a phased response, it can be at GP level, gynae level, or indeed at a specialist centre level. Now, there has been progress in terms of endometriosis in the last number of years. About 5 million additional has been spent, about 2.1 million has been allocated for this year. And essentially, and I would ask maybe if you could, if it's allowable to forward the correspondence to us, because you mentioned 3.5 years, or I think Nikita did. We have 2 supra-regional hubs already established now, in Tala and in Cork. The Cork one opened recently. So there are about, the estimates are saying, and they're conservative estimates, about 350 severe cases, and Nikita clearly is in the severe category, per year will require referral to the specialist endometriosis clinics and services, and they're located in Tala and Cork. Now, in addition to those, you have 5 other hubs across the country, in the Rotunda de Coombe, the National Maternity Hospital, the University Hospital in Limerick, and the University Hospital in Galway. And there are about 760 women who are on a specific waiting list for treatment at the end of last year. And the agenda is to get through the backlog as quickly as we possibly can. There are discussions underway, and hopefully the national framework in respect of endometriosis can be concluded, but there's engagement with GPs and between the GPs and HSE in terms of the precise role of primary care versus gynae care, and then obviously the specialist hubs. About, as you say, 1 in 10 women will have this condition. And there is the development of a national endometriosis framework. I know the Minister is keen in bringing this to a conclusion. This was discussed in the House previously, or questions have been asked in respect of it. So the model of care has been outlined. There's a clear framework there. Investment is happening. Investment will continue. And it's on top of very significant investment in women's health over the last number of years, which has been quite transformative compared to what was there. And there's been very specific investment on a whole range of areas pertaining to women's health. This is one area that does need further investment, but also needs essentially for the national framework to become included. And again, we would, in terms of the 2 super-regional hubs, they're there for the specialist severe cases now. And the referrals should be sent there in the context of Nikita's letter, it would seem to me, and I haven't the full background to it. But for us, we acknowledge fully it's a very real issue for women, involving very severe pain, impacting on your personal life, on your working life, and it is something that government is very committed to addressing.
Mary McDonald.
Thank you. So Nikita is 18. I'm more than happy to forward the correspondence to yourself and to the Minister, of course. Nikita will travel to Romania to get the care that she requires. And the facts are, Taoiseach, despite your assertions in your response, that the levels of care here are simply unacceptable. I know of a woman who lost a kidney to endometriosis. I know a 27-year-old who went through a radical hysterectomy because the disease in her case had eaten away at her pelvic organs and her bowel. So the services are not available for women, and I don't think there should be any attempt to dismiss or to downplay the real experiences of women and girls. And they are asking now for proper investment, for a framework by all means, but we need a specialised centre that offers the care that's required. Experts have been telling you for a decade that excision surgeries are the only way to go. You know this, and yet that treatment and that service is not available. So why is government instead offering treatments that the experts have told you will fall short, will fail? And please, I appeal to you to listen to the voice of this young woman and to the other women whose lives have been devastated by the failure to provide them with the care that they need here in Ireland. And so many of them are now travelling. That's the evidence, most damning evidence of the government's failure.
But there has been significant progress in this area, Deputy, and that has to be acknowledged. Over 200 new patients were seen in Cork's endometriosis service from May to December of last year. About 94% of women on the waiting list now in that region are seen within 6 months. And indeed, as I said, more generally, we are seeing improvement in terms of the Tallaght Centre also. So the government is listening. Government has actually been engaging, or the HSE has, and in terms of the state, everybody involved in this area, to get the national framework concluded, so that there will be a comprehensive range of services covering the entire span of symptoms or manifestation of the condition. In other words, from primary care to the hubs, to the super-regional hubs. And specifically, there is specialist care there available. There is ongoing recruitment. Additional posts are being recruited as we speak, specifically for this area. Agus ad a bhíam gur bhfuil géar gá ann, níos mó inistíocht céir ar fáil, tá míad ag déanamh é sin fí láthair agus sin an aim atá going. Agus, when you look at all the other developments in women's health over the last 2 to 3 years, we can do this and we will do this. And I think there's been some very significant developments, and I'm not going to list them all, but they're there. And in terms of endometriosis, it will be manifest as well. Already is, in terms of the 2 super-regional hubs are there, and in terms of the 5 other hubs. It is important to get the framework
Thank you,
completed.
Taoiseach.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.